Spinal cord compression. What is spinal cord compression? So, your spinal cord, they has nerves that send the signal or the messages back and forth between your brain and the rest of your body. Here, the spinal cord compression occurs when a mass places the pressure on the cord. A mass can include the tumor or the brain fragment. Compression can develop anywhere along the spinal cord from the neck to the lower spine. Here, what are the symptoms of the spinal cord compression mechanism? The symptoms of the spinal cord compression, they can vary. They depend on how the severe the compression is and what are the areas of the spinal cord is compressed. One of the most common symptoms is the stiffness or the pain in the back or the neck top, and the numbness or the weakness in the legs, hands, and the arms that can also develop. A condition known as the cauda equina syndrome that can develop if the compression is on the lumbar area. The symptoms of this syndrome include they have the severe pain and the weakness in the legs, a loss of bowel and the bladder control, severe numbness in the back of legs and the inner thighs. The spinal cord compression affects the fine motor skull and they also find the skills and the coordination. Here we can look the causes of the spinal cord compression. There has a many possible causes. The compression can come on the suddenly in some cases. Compression can occur over time in other instances. The cause of the spinal cord compression include the following: certain degenerative disease such as the arthritis that can lead to the spinal cord compression. A ruptured disc, they may lead to the spinal cord compression. Injury to the spinal cord or the area around the spinal cord lead to the swelling which can cause the compression. Bleeding disorders, they are coupled with the chiropractic manipulation that can result in the large clots compressing the spinal cord. Bone spurs that can narrow the spinal canal, causing the compression of the spinal cord. Cancerous and the non-cancerous tumors can grow in the space near the spinal cord. The tumor can put the pressure on the spinal cord if this occurs, causing the compression. See here we can look who are at the risk for the spinal cord compression. Anyone can have an injury or develop the condition that can lead to the spinal cord compression. A few factors may increase your risk. Use of poor lifting techniques may increase your risk of neck or the back injury which can cause the spinal cord compression. People who have the osteoarthritis may also be at the increased risk for developing the spinal cord compression. Doctors can diagnose the spinal cord compression by performing the medical history and the exam along with the X-ray of the spine and the CT scan or the MRI test. Both the CT and the MRI can provide the detailed image of your spine. The doctor may order the myelogram in some cases. This involves injecting dye into your spinal area and then taking the CT scan of the area. So here we can find how we can treat the spinal cord compression. Treatment for the spinal cord compression depends on the causes and the severity of the compression. Your doctor may recommend the reduced physical activity or the immobilization treatment. They plans for the anti-inflammatory medication that may help decrease the swelling and reduce the pain. Epidural steroid injection into the spinal area may help treat the symptoms of the spinal compression. Many people with the spinal cord compression may benefit from the physical therapy. Exercise can help strengthen the abdominal leg and muscles, and this strengthening may help decrease the symptoms. Home care suggests applying the ice packs and heating pads and taking over the counter. Pain relievers can help relieve the pain. Alternative treatment can include the acupuncture or the acupressure. Chiropractic manipulation should be used for the spinal cord compression according to the American Academy of the Orthopedic Surgeons, where doctor may prescribe the other treatments such as the radiation therapy or the chemotherapy to shrink a tumor that's causing the spinal cord compression. Surgery may be an option if more conservative treatments don't work. The appropriate type of surgery depends on the cause of compression. Surgeons can fuse vertebrae together. They remove the bone spurs or increase the space between the vertebrae. So here we can look what is the outlook for the people with the spinal cord compression. The cause of compression along with the severity of a symptom that affects your outlook. Some people respond well to the treatment while others may not. Here we can it may not possible to prevent the spinal cord compression in all cases, but there are so many possible causes. Maintaining a healthy weight and getting the regular exercise can help reduce the added pressure on the back and the symptoms of the spinal compression. Learning how to lift properly may decrease your likelihood of the injury. Thank you.